Good day, friends. I am Dr. Yang. As a health expert, it is my privilege and responsibility to address topics that are crucial to our well-being, yet often shrouded in silence and misunderstanding. Today, we are going to have a frank, honest, and comprehensive conversation about a subject fundamental to the health of half our population, vaginal hygiene. This is not a topic for whispers or embarrassment. It is a cornerstone of a woman's overall health, confidence, and quality of life. So, let us lean in, listen, and learn, because knowledge is the first and most powerful step toward empowerment. The vagina is a remarkable and sophisticated part of the female body. It is a self-cleaning, self-regulating ecosystem, a masterpiece of biological engineering. Think of it not as a sterile, empty corridor, but as a thriving, microscopic rainforest. This ecosystem is home to a delicate balance of bacteria, primarily the beneficial lactobacilli. These good bacteria are the guardians of your vaginal health. They produce lactic acid and hydrogen peroxide, maintaining a naturally acidic environment with a pH typically between 3.8 and 4.5. This acidity is crucial. It acts as a defensive shield, inhibiting the growth of harmful bacteria, yeast, and other pathogens that can lead to infections, discomfort, and more serious complications. The goal of true vaginal hygiene, therefore, is not to scrub this environment into sterility, but to support and protect this innate, wise system. It is about being a good steward of your own body, working with its natural design, not against it. Our journey into understanding simple and effective ways to maintain this health begins with the most fundamental practice, cleansing. And here, perhaps more than anywhere else, is where well-intentioned mistakes are most often made. The vulva, the external part of your genitals, requires gentle cleaning. The vagina, the internal canal, does not. The mantra to live by is, clean the vulva, leave the vagina alone. This means absolutely no douching. Douching is the process of flushing the vagina with water or, worse, commercial mixtures of fluids. Marketing may have historically told you it leads to freshness, but science tells us unequivocally that it leads to trouble. Douching is like sending a tsunami through your delicate vaginal rainforest. It washes away the protective lactobacilli, disrupts the healthy pH balance, and can push pathogens deeper into the reproductive tract. Numerous studies have linked douching to a higher incidence of bacterial vaginosis, yeast infections, pelvic inflammatory disease, and even complications in pregnancy. Your vagina is designed to clean itself. The clear or whitish discharge you experience is a normal part of this process. It is the vagina's way of flushing out dead cells and bacteria. Trust this process. So, how should you clean the vulva? With gentle, mindful consistency. Use warm water. That is often all you need. If you wish to use a cleanser, it must be the right kind. Choose a mild, unscented, pH-balanced soap or a cleanser specifically formulated for the intimate area. Avoid anything with deodorants, perfumes, strong antibacterials, or harsh surfactants. These chemicals are irritants. They can strip away natural oils, cause inflammation, and disrupt the very pH you are trying to protect. When washing, use your hand, not a rough washcloth or loofah, which can harbor bacteria and cause microabrasions. Gently cleanse the folds of the vulva, and then rinse thoroughly with warm water. Pat the area dry with a clean, soft towel. Moisture is a friend to yeast and bacteria, so ensuring the area is dry is a simple yet powerful preventative step. Moving from cleansing to drying, let's talk about the clothes you wear. What you put on your body matters as much as what you put on it. Your vaginal environment thrives in breathable conditions. Tight-fitting clothing, especially synthetic materials like nylon, polyester, and spandex, can create a warm, moist, airless environment, a perfect breeding ground for unwanted microorganisms. This is not to say you can never wear that favorite pair of skinny jeans or your go-to yoga pants. The key is moderation. Make loose-fitting, breathable clothing your daily default. Choose cotton underwear whenever possible, as cotton is a natural, breathable fabric that allows for air circulation and moisture wicking. When you sleep, give your body a complete break. Consider sleeping without underwear to allow the area to breathe fully throughout the night. And immediately after a workout or swimming, do not linger in damp, sweaty clothes or a wet bathing suit. Change into dry, clean clothing as soon as you can. This one simple habit can significantly reduce your risk of recurrent yeast infections. Now, let us delve into a topic that intersects with nearly every aspect of a woman's life, the management of menstrual hygiene. Your period is a natural, healthy process, and how you care for yourself during this time is paramount. The cornerstone here is frequent changing. Whether you use pads, tampons, or menstrual cups, stagnation is the enemy. Blood is a medium in which bacteria can multiply rapidly. Changing your pad or tampon every 4 to 6 hours, even if the flow seems light, is a non-negotiable rule. Wearing a tampon for too long is not only a hygiene risk but is also associated with the rare but serious condition of toxic shock syndrome. Be mindful of the materials in your menstrual products. Just as with soaps, scented pads and tampons can introduce chemicals and perfumes that can cause irritation and allergic reactions, disrupting your delicate pH balance. Opt for unscented, unbleached cotton products whenever possible. Menstrual cups, made from medical-grade silicone, are an excellent alternative for many as they collect rather than absorb flow and do not contain the chemicals sometimes found in other products. Whatever you choose, ensure you wash your hands thoroughly before and after inserting or changing any menstrual product. And after your period ends, give your underwear an extra thorough wash to ensure any residual discharge is completely cleaned away. Our discussion would be incomplete without addressing the intimate connection between what you consume and the health of your vagina. You truly are what you eat, and your vaginal flora is a direct reflection of your internal health. A strong immune system is your first line of defense against any infection, and that starts with nutrition. A balanced diet rich in whole foods, fruits, vegetables, lean proteins, and whole grains, provides the essential vitamins and minerals your body needs to function optimally. Specific nutrients play a starring role. Probiotics, the beneficial bacteria, are your allies. You can incorporate them into your diet through fermented foods like live culture yogurt, kefir, kimchi, sauerkraut, and kombucha. These foods help replenish and support the population of good lactobacilli in your body, including your vagina. Prebiotics are also important. These are the fibers that feed the good bacteria. They are found in foods like garlic, onions, bananas, asparagus, and whole grains. Staying hydrated is another simple yet profoundly effective strategy. Drinking plenty of water helps to flush toxins from your body, keeps all your tissues hydrated and healthy, and can even help dilute urine, which is beneficial if you are prone to urinary tract infections. Conversely, it is wise to be mindful of foods that can potentially trigger issues for some individuals. Diets very high in sugar can sometimes promote yeast overgrowth, as yeast feeds on sugar. Pay attention to your body. If you notice a pattern of discomfort after consuming certain foods, it may be worth discussing with a healthcare provider. Sexual activity is a normal and healthy part of life for many women, and it has a direct impact on vaginal health. Practicing safe sex is not just about preventing pregnancy or STIs, it is also about protecting your vaginal ecosystem. Semen has an alkaline pH, around 7.1 to 8, which can temporarily neutralize the vagina's protective acidity. This is not a cause for panic with a trusted partner, but it is a factor to be aware of. Urinating after sexual intercourse is one of the most effective habits you can cultivate. It helps to flush out any bacteria that may have been pushed near the urethra, significantly reducing the risk of developing a urinary tract infection. Lubrication is another key consideration. Friction during sex can cause microtears in the delicate vaginal tissue, creating entry points for bacteria. If natural lubrication is insufficient, please do not hesitate to use a lubricant. But choose wisely. Opt for water-based or silicone-based lubricants that are free from perfumes, flavors, and glycerin. Glycerin, in particular, can be broken down into sugar in the body and can promote yeast growth for some women. Avoid using anything oil-based, like petroleum jelly or baby oil, with latex condoms, as it can degrade the latex and cause condom failure. And let's be perfectly clear, the vagina has no need for any enhancements. Steer clear of novelty items, tingling lubricants, or any product designed to change the smell or taste of your vagina. These are almost universally irritating and disruptive. As we navigate through life, our bodies change, and our vaginal health needs evolve. During pregnancy, for instance, increased blood flow and hormonal shifts can lead to more discharge and can make you more susceptible to yeast infections. It is more important than ever during this time to practice gentle, non-invasive hygiene and to communicate any concerns with your obstetrician. During perimenopause and menopause, declining estrogen levels lead to physical changes. The vaginal tissues can become thinner, drier, and less elastic, a condition known as genitourinary syndrome of menopause. This can make the vagina more vulnerable to irritation and infection. Using a doctor-recommended, pH-balanced moisturizer and, if appropriate, vaginal estrogen can be transformative for comfort and health during this stage of life. It is essential to maintain open communication with your healthcare provider through all these transitions. Finally, we must address the most important partnership in your health journey, the one with your healthcare provider. So much of the anxiety and misinformation around vaginal health stems from a place of silence. You are the expert on your own body. You know its normal rhythms, its typical sensations, and its unique signature. Any deviation from this baseline is a signal worth listening to. Be vigilant for signs that something may be amiss. These signs include a discharge that changes in color, consistency, or smell, particularly a strong, fishy odor, persistent itching or a burning sensation in or around the vagina, redness, swelling, or a rash, pain during intercourse or urination, and any unexplained bleeding or spotting. Do not fall into the trap of self-diagnosing and self-treating based on internet searches or the advice of friends. What looks like a yeast infection could be bacterial vaginosis, or something else entirely. Using the wrong treatment, like an antifungal cream for a bacterial issue, can worsen the problem. When you notice a persistent change, make an appointment with your gynecologist or primary care provider. They can provide an accurate diagnosis and the correct treatment. There is no shame in experiencing a vaginal infection, they are incredibly common. The shame lies in suffering in silence due to misplaced embarrassment. In conclusion, maintaining vaginal health is not about complex rituals, expensive products, or achieving an arbitrary standard of freshness sold to us by advertising. It is a practice rooted in simplicity, consistency, and respect for your body's innate wisdom. It is about choosing breathable fabrics, gentle cleansers, and a nutritious diet. It is about adopting smart habits during your period and after sex. It is about listening to the signals your body sends you and having the courage to seek professional help when something feels wrong. This is a journey of lifelong stewardship over a vital part of your being. By embracing these straightforward, evidence-based practices, you are not just preventing infections, you are investing in your comfort, your confidence, and your overall well-being. You are claiming ownership of your health. This message is too important to keep to yourself. Many women and young girls are navigating this in the dark, confused by myth and marketing. You have the power to be a source of light and clarity. If this conversation has been valuable to you, if it has demystified a topic or given you a new tool for your health toolkit, I urge you to share it. Share it with your daughters, your sisters, your mothers, and your friends. Start a conversation. Break the cycle of silence. Like this message if it resonated with you, and subscribe to this channel for more honest, expert-led discussions on the health topics that matter. By sharing this knowledge, you are not just passing on information, you are contributing to a world where every woman feels informed, empowered, and confident in caring for her whole self. Thank you.